As chiropractors, the most common thing we see is low back pain. One of the most severe forms of low back pain that we see is a lumbar disc injury. Lumbar disc injuries can severely hinder patients' daily activities and what we call your ADLs. One thing that we hear very commonly is that patients are having pain or struggling when they cough, sneeze, or bear down to go to the bathroom. This is actually mimicking one of the orthopedic tests that we use called a Valsalva maneuver. And when we hear that and we have a positive Valsalva maneuver, that helps us confirm a patient's history and their clinical exam to confirm what might likely be a lumbar disc injury.
For our nerve glides, what we're going to do is you're going to be started in a seated position, and what you're going to do is you're going to pretend that you have a string attached from your nose to your toe. And what you're going to do is you're going to kick your foot out. When your foot goes out, head goes back. And then when your foot goes down, head goes down. And what you're going to do is you're going to repeat this back and forth. Should feel a nice, easy, pain-free range of motion. If you're starting to get pain or noise in your leg from this exercise, it's not a good exercise to do at the moment, so discontinue it. If it feels good and you are starting to decrease in pain, do this 10 times up to 10 times a day.
When it comes to managing low back pain, one of the first things we're going to try to do with our patients is find a directional preference. Now, directional preference is just what direction can your back move, what direction can you move that is not painful. Generally speaking, that's going to be flexion or it's going to be extension. Now, for a flexion exercise at home, we'll get you to lay onto your back, pull your knees towards your chest, hold that for a few seconds, and then come back down. If that relieves your symptoms or does not cause any increase in your symptoms, your directional preference could be flexion. For an extension-based exercise, we'll go onto our stomach, press our upper body away from the table or the floor, and if that either does not increase your symptoms or makes your symptoms feel better, your directional preference could be extension. Now, if you do both of those and neither of them feel like they're doing anything to your symptoms, or if both of them feel like they're increasing your symptoms, that's a good sign to come in and see us.
One of the most common forms of treatment in our clinic for lumbar disc injuries is mechanical traction. Mechanical traction provides a great distraction or axial pull through the lumbar disc, which helps decrease disc irritation and calm down irritated soft tissues around the spine. So we'll generally start there to calm things down. As we progress, we'll typically move patients into some form of chiropractic manipulation, which is great to get the spine moving and continue to help calm things down. It's important to know that lumbar disc injuries are not a contraindication for manipulation, but we have to be careful during what phase of care we deliver them because it could be very uncomfortable for the patient and not beneficial. While we're progressing patients through a lumbar disc protocol, we're always being aware and reminding patients to pay attention to what we consider clinical red flags. Clinical red flags for a lumbar disc injury are things such as loss of bowel or bladder control. If any of those things occur, you need to report to the emergency room because that is an emergent situation.